COVID-19 pandemic, the SARS-CoV-2 virus spread rapidly. Unfortunately, some individuals were affected by severe symptoms in the acute phase requiring hospitalization. The COVID-COG project aimed to study the long-term cognitive effects of SARS-CoV-2 infection. The researchers were first interested in the neuropsychological consequences 6 to 9 months after infection. They then sought to find out what factors might be predictive, particularly by studying immunological variables during the acute phase. 61 participants were included in the study 6 to 9 months after their hospitalization, some in intensive care, others in intermediate care. These individuals presented no health problems that could have impacted on cognitive function prior to their SARS-CoV-2 infection. As a first step, the participants were welcome to conduct an interview called anamnesis. During this interview, the patient was asked to relate the history of his or her illness and to explain any persistent difficulties. Participants then underwent an exhaustive psychometric examination. This exam assesses cognitive functions such as memory or language. Through the results of this study, the researchers observed the presence of cognitive disorders, sometimes of severe intensity, mainly in the area of memory. Unexpectedly, these same patients did not report subjective complaints when asked about their memory abilities. Not being aware of cognitive difficulties is a well-known symptom in neurology called anosognosia. Based on this observation, the purpose of the study was to determine whether certain immunological markers collected during the acute phase of the disease could predict the appearance of anosognosia. To do this, we must go back 6 to 9 months earlier at the time of hospitalization. During acute hospitalization, a complete blood count was performed for each patient. In this context, the leukocyte distribution was extracted. It is important to note that this data was collected on the first day of hospitalization before any treatment was administered. The leukocyte distribution was compared between anosognosic patients and patients without this symptom. In addition, the predictive value of the percentage of monocytes was calculated. The results of these analyses showed that the percentage of monocytes in the acute phase was significantly higher in anosognosic patients compared to others. More than 7.35% of monocytes in the acute phase leukocyte distribution were found to present anosognosia 6 to 9 months after infection. In conclusion, variations in innate immunity, in particular the percentage of monocytes in the acute phase, would allow, based on these results, to differentiate and predict individuals with anosognosia from their memory disorders 6 to 9 months after infection. Moreover, structures of the limbic system could be associated with these immunocognitive relationships. This work is paving the way for the study of the links between immunology and cognitive impairment in post-COVID-19 syndrome, as well as other pathologies of the central nervous system. All the work of the SEN Lab can be found on the website senlab.ch.